Welcome back to the Healthy Chicago podcast, where local health professionals and their guests discuss the latest public health issues affecting Chicagoans.
So welcome back to another episode of Healthy Chicago podcast. I'm Monica Mitchell, and I'm a public health administrator. And we're going to be talking about maternal mental health because May is Maternal Mental Health Awareness Month. So I work with a program called Family Connect Chicago. And prior to working with that, I was also working as a mental health clinician. So I worked with maternal health as well and maternal mental health. And before we kind of talk about our topic a little bit more, I wanted to just let people know a little bit more about Family Connect Chicago. So we are a new service that CDPH is offering that provides a free nurse visit. And it's designed to make sure both the mom and the baby are healthy, and it's evidence-based. So one of the things that we do with Family Connect Chicago is we have what we call a community alignment board. So that's a lot of different providers that do services such as mental health, medical, childcare. And I'm excited because one of our providers is here today that's a mental health provider, Beyond Baby Blues. So welcome, Nancy Segall. She's a licensed, thank you. She's a licensed clinical social worker here with Illinois. Nancy, can you tell us a little bit more about Beyond Baby Blues?
Yes, I would be happy to. So our program began in 2011, actually at the request of some of the staff from the perinatal depression program at Evanston Hospital. They felt that their patients had access to therapy and to medication when needed, but there was not a group. And they understood that a group could be very powerful. And so I and two of my colleagues whom I'd been working with previously, we kind of took that as a challenge, like, can you do this? And we said, yes, we think we can. So we were able to obtain a 501c3 so that we could be a not-for-profit. And we started, sending flyers out like crazy and trying to connect with resources all over. And now, what is that? So it's 2024, so it's 13 years later. Oh, my goodness. We have a thriving program in which we offer groups for women who are pregnant, postpartum, or who have experienced a perinatal loss.
Yeah, so Nancy, I'm glad to hear about how Beyond Baby Blues has grown. And from my understanding, if women wanted to work with Beyond Baby Blues, there's no cost to them. Is that correct?
That is correct. Our groups are free for everyone. Like your visits are free for every woman who's had a baby, correct?
Yes, that's correct. So with you mentioned some of the groups for women that are pregnant. So I guess I'm just kind of curious with a lot of talk about postpartum depression. So it sounds like that's something that women can kind of start to experience during pregnancy.
Yes, that is true. And I think one of the things that has happened is that there are a number of struggles that women can have that get put under the title of postpartum depression. But what we actually call it, and what is more accurate and descriptive, is perinatal mood and anxiety disorders, which means they can occur anytime between conception and 12 months after a baby is born, and that they include depression or anxiety during pregnancy, postpartum, or any time within that first year.
Yeah, and I guess it's good to know for the people that may be listening in and watching this that, it is something that a lot of women do experience. Would we happen to know about how common we would say, if we had to say, maybe 1 out of 10, or what do the numbers kind of look like for depression and anxiety?
The numbers look kind of worse since COVID, like many other things. They have inched more toward, I think, 20%, and the range used to be given as 15 to 20%. But I think that there have been so many challenges to women over the past 4 years in so many ways, economically, with employment, with childcare, that it's made a greater challenge for women.
Yeah, definitely. What are some things that women can do to get better?
Well, I think the very first thing is to be willing to be honest with yourself And then once you're honest with yourself, to feel like you can be honest with your doctor. For most women, that would be their OBs, though sometimes with their PCPs, and to share that information, and then to be referred to an individual therapist, hopefully, to be given information about group opportunities, such as Beyond the Baby Blues, and then for a woman to decide with her doctor, with her prescriber, whether or not she would be interested in considering taking some medication that would kind of give her relief sooner than some of the other resources would.
Yeah, that's good for women to know. I guess we kind of hear a lot about baby blues and things like that, that I know is pretty common after birth. But I guess how can someone be able to kind of figure out if it's baby blues or if it's like the depression?
Good question. First of all, baby blues traditionally last 2 to 3 weeks and no longer. If a woman has had any kind of mental health history, if she's ever had depression, she's ever had anxiety, she's had trauma in her life, it ups the likelihood that she would have some kind of perinatal distress after she has had her baby, whether that is anxiety or depression. So women themselves kind of need to be alert. They need to be aware. Oh, I had a rough time 3 years ago when my brother died, or I know that ever since I was in high school, I've had some anxiety, and to realize that that means that there's a greater chance that they might have some postpartum distress, and that then they need to share that. And they should be given resources.
Okay. Yes, and a good thing about Chicago is we do have a lot of different resources for women, or just people that may have depression too as well. So that's the first step, as you mentioned, sort of reaching out for the moms that like for different reasons, if they're not able to get treatment, or if they have some stigma for treatment. Can you talk a little bit about like how that can impact like the infant's development? Like if the mom is, for example, has depression that she hasn't gotten addressed.
Right. That's always been one of the big concerns about a woman not accessing health. We don't see that a lot, because the women are reaching out to us so quickly that we're able to give them support before there's any kind of adverse effect upon the baby. And I don't think that I think babies are very forgiving in the first weeks. Somehow, somewhere in their little brains, they know mama needs to adjust to this too. So if a mom is struggling somewhat in the first couple weeks and not feeling quite as happy or quite as connected to her baby as she thought she would, that's not the end of the world. It's more when it persists, beyond those first few weeks. That's when it's indicated that to prevent any kind of negative impact on the baby. And also, we're all about mamas at Beyond the Baby Blues. We know that a happy mama makes for a happy baby. So that's where we kind of put our emphasis, is on helping women, because we know that will help their babies as well.
Yes, those are good things to know that they have available, like for people that wanted to help a new mom that they think that either might have some depression or some anxiety. Like, what are some things that like other family members could maybe do to help out?
I think one of the barriers to women reaching out is a sense of shame at times, embarrassment, and the false belief that she is alone, that she is having a struggle, but other women don't have struggles. Whereas, as we just talked about, probably close to 1 in 5 women is having a struggle. So I think just making it that far to realize that you don't have anything to be ashamed of, and families can help with that, and that you're not alone. You just maybe don't know anyone in your world right now who's talking about a struggle during pregnancy or postpartum. But that doesn't mean that there aren't people in your very own social world who are struggling, because women are often reluctant to be open about it. And one of the things that happens in our groups is women are very open about what they're experiencing, because otherwise there's no group process. Women talk about how they've been feeling all along. They talk about birth experiences. Sometimes women have fine pregnancies and have been very excited about having a baby, and then they have something that approaches or is actually a traumatic labor and delivery, and it kind of throws them off their game, and they end up experiencing a lot more emotional distress than they ever imagined might happen. So to just kind of like normalize that, we do a lot of normalizing so that women will not feel like they're different, like they're isolated, and they're not.
Yeah. And it's always been like my understanding that one of the benefits of like a group therapy or support group, in addition to like individual therapy, is that it kind of helps with the normalizing, but giving you like that connection with other people too.
Mm-hmm. Very much so. I think that from the very beginning, from the very first session, because I don't think we talked about the fact that our groups are just 6 weeks long. We don't offer long-term groups. They're 6 weeks once a week for an hour and a half each time. And I think so much kind of like magic often happens during week one when women look at the screen, because we are on Zoom. They look at the screen and they realize these women look just like me, and they're talking about experiences just like mine, and nobody here seems like a bad person or a bad mother. They're just having a hard time.
Yeah, and that's good that people are able to get that, and to not, feel like there's anything wrong with them or anything about them as a mom when they go to these groups. You mentioned that they're virtual. So with the groups with women, for example, like that may not speak English, like can you talk a little bit about some of those options that your organization can provide?
Well, we have just started our very first affinity group, which is for women who speak Spanish only or speak such a limited amount of English that it would be very difficult for them to be in one of our general groups. They wouldn't have the facility with the language that would make them comfortable. So we are just now starting Spanish language groups, Spanish groups for non-English speaking women. And we're very excited about that. It took us a long time to put all the pieces together. We really worked for over a year to be able to get to this point where we could offer this group. And I imagine that we will be offering that as part of our regular stable of groups in the future.
Yeah, that's good. And I think what some of the things you mentioned about Beyond Baby Blues is that it's like sort of a standalone. So it's meant to be part of your treatment. And it as opposed to someone just having the group and sort of, not getting like at least talking to the individual therapist or their provider.
Right. We are standalone, but we always like to be part of a therapeutic community. So we are always encouraging women and helping women to connect with therapists, regardless of what their insurance is. We are able to help them to access therapy, which we think is important. And usually, if a woman says, yes, I think I would be interested in some medication as a way to kind of jumpstart my recovery, their own medical providers are able to prescribe that. And that's another thing that I think our groups normalize is the value of the medication.
Yes, for some people that have the postpartum or anxiety, like that can be very beneficial to help.
It really can.
Have you had like some conversations in groups where like moms may have been worried about if the medication would impact them, like say if they want to breastfeed?
Yes, that is sometimes a woman's concern. It is laid to rest if she speaks to her provider or providers, because they know which medications have been determined to be safe to take while a woman is breastfeeding. Nonetheless, we have some women who come to us who say, I don't care what they say. I don't feel comfortable taking medication while I'm breastfeeding my baby. And so obviously we're not going to argue with them. They need to do what feels right and comfortable to them. So then they would maybe wait to take medication until they have stopped breastfeeding, or if they realize that the medication at that moment might be more beneficial to them and their babies than the breastfeeding, they might switch to bottle feeding. But the research does substantiate that there are a number of antidepressant, anti-anxiety medications that a woman can very safely breastfeed on.
Yeah, so I think that would be, good for moms and women to be able to look at those options too if they have depression or anxiety. So if we were to kind of look at from here, like what would be like some things that we would want to share for the viewers, like about like either beyond baby blues or anything about postpartum like depression or anxiety.
Okay, so one of the other things that I do, I speak with every woman who has an initial interest in Beyond the Baby Blues. I do our intakes. And one of the things I always want to make sure they know is that our group is one with cameras and microphones on. And sometimes women, they want some help, but they're not ready for that. They don't want to do it that way. And so I am able to tell them about another wonderful program called Postpartum Support International, which is fully remote. They don't do anything live. Well, they do live with sound, but they don't do any camera work. So a woman would be able to sign up for one of their groups, and she can even be like a lurker. She doesn't have to have her camera on. She doesn't have to have her mic on. She can just listen to what the other women in the group are saying. And sometimes that works very well for women who just aren't ready to be in a very highly participatory group. And they offer so many wonderful varieties of groups for pregnant and postpartum women, as well as for women who've experienced losses. And they can be found at postpartum.net. And it's like a very, very robust website with lots of information and opportunities. It's a wonderful organization. And it's perfect for women who want something that's kind of like less intimate than being in a group with 5 or 6 other women.
Yes, thank you. I'm familiar with that website. I believe they can help with individual therapy too.
Yes, from their website, yes. They can help you to connect. And we also we will work through the Moms Line that's part of Evanston Hospital to help women connect with a therapist as well.
Yeah, I'm familiar with the Moms Line and just the benefits that they have, that we have a local resource like that is available specifically to support women that are pregnant postpartum. So that's nice. I know that there's also sort of the national hotline that does something similar. So that's the TLC Mama hotline. But I always like that, when there's also options for people that want to have that like local connection.
Right.
As well.
And we are very fortunate in that sense, because not every state has something like the Moms Line that we have.
Yes. I would think that there is very few, if any, besides Illinois, that has this resource for the moms to connect to. Yeah. I know with Family Connects, we do see a need for the behavioral health for some of the moms that we work with. So our nurses do utilize the Moms Line as a resource too as well.
Yes. I know. And also we have directly received some referrals from your program as well.
Yes. So I think if we were to sort of look at like different ways that we talked about moms can get better, and like some of the things that I feel like we talk a lot about in therapy is like self-care. Like what can we kind of say about that? Because that could look different for a lot of different people.
Right. I think every woman has to define what to her will feel like good, caring treatment, you know, informally within her home, within her family, within her community. And they would be kind of like adjunctive sources of support. Because I think this is important to know. I speak to many women who have loving and devoted partners, have very emotionally present parents, have friends, have jobs they're looking forward to going back to, but they are still experiencing perinatal mood disorders. And that is because, you know, part of it is just how your particular brain and body respond to all the hormones that have been cascading through your system since you became pregnant, and then take this deep dive as soon as you give birth. And then, of course, your own, you know, genetic or personal history that just might make you more vulnerable to depression or anxiety than some other women are. And sometimes you might be suspicious when you're pregnant. I wonder if I'm going to have a hard time. And other times you don't have the smallest suspicion. And you're just kind of like sometimes literally gobsmacked with negative feelings that you did not anticipate at all.
Yeah, that's definitely.
And one other thing, I think I mentioned this before, but it is important. If for women who've had very complicated labors and deliveries, a baby maybe who needed to be in the neonatal intensive care unit for a period of time, or mom herself had some adverse medical experience during the labor and delivery, the likelihood that they're going to struggle emotionally is considerably higher. Not because it's anybody's fault, it just has happened.
Yeah, and it's like just what you mentioned, it's a lot, so it makes sense because of like the hormones, but then if you have a experience that was not the best kind of birthing experience, complications, situations where the baby might have to be in the neonatal unit, like if they were born early or their low birth weight, kind of just can put like extra kind of stress.
Or like an emergency C-section. I speak to a lot of women who, you know, were totally prepared for a vaginal delivery, and then there's some kind of hiccup during labor, and they're told we need to do a C-section. And sometimes that can be very unsettling for a woman.
Yeah, especially if you kind of have gotten to the point where you sort of had like a plan of how you wanted your birthing experience to be, or like who you wanted in the room and things like that. And then you have like this emergency situation that kind of like changes it. And then if you combine that with like any kind of complication, so that kind of makes a lot of sense that you would see things like that.
Yeah, it's really stacking the deck. Not in a good way. Yeah.
Yeah, and then I guess for some women too, like if it is a situation where for whatever, you know, reason they may not have a lot of the support, or they may not know a lot about, you know, how to navigate the health system and things like that, or the social service system outside of, you know, what they've experienced. So
sometimes what that suggests is that it's important for women to speak up while they're still in the hospital if they think they're already struggling or feel like they might be struggling, because their healthcare teams in the hospital should definitely be able to give them resources that they can investigate once they're out of the hospital. And I think that's really important. Plus, I don't think there are many medical providers who deliver babies or nurse practitioners who deliver babies who aren't aware that there are a lot of resources out there to support women. So that information should be very upfront and easy to obtain. And the times that leave me the most frustrated, I ask every woman who calls us, how did you find out about us? And occasionally the answer is, I kept Googling until I found it. And I see that as a major failing of our health system if that can happen. It's not that they have to hear about us, but they have to hear about a range of options that will support them through a challenging time.
Yes, I'm glad that you shared that, because I think from what we've heard from like some of the data about just maternal health in general is that sometimes it's a lot of systems, but they may not always be what we call coordinated. Mm-hmm. So it's hard for them to communicate and people to kind of know about that. So that's something that we look at with, CDPH, and then also with making sure that things like that do not need to happen as often for women. Mm-hmm. If people wanted to know a little bit more about Beyond Baby Blues in particular, and like how to connect to your organization for services, how would they be able to do that?
I think the easiest way is to go to our website, which is www.beyondthebabyblues.org. And on there's a Squarespace form which they can fill out and which then comes to me. And then I reach out to anyone who's filled out one of those forms and set up a time when the woman and I can speak. So I can tell her all about our groups and learn something about what her experience has been. So that's really the easiest way to connect with us.
I am glad that we did have this conversation today. So I thank you again for joining us.
It's been my pleasure.
Yes, thank you. So it's good for our viewers to have heard about Beyond Baby Blues, but then also learn a little bit more about postpartum depression and anxiety. Mm-hmm. So we're glad that you were here, and thank you all for listening in. Please sure to tune in our next episode.
And that's our show. Thanks for joining us today. Don't forget to rate and subscribe wherever you find podcasts. I'm Dr. Bora, and we'll see you next time.